Hello, friends. Good morning. Good morning. Happy Wednesday. Thanks for jumping on. If you can hear us, go ahead and drop a note in the chat, just so I know that audio and video and all that is working good through Zoom. We'll give it another minute or two, and then, or not a minute or two, we'll give it about 10 seconds, I guess, and then go ahead and get started this morning. Sheila, thank you for letting us know that you can hear us. Friends, we got some good stuff planned today. This is the first of three, what we call executive briefs in a series that's going to extend over the next couple of weeks on a roughly a bi-weekly cadence. So today, we've got today, the next one's coming up on November 3rd. And we are talking through kind of what we are hearing in the market, what we're understanding to be true, and what we're hearing from our client base. Totally centered around the vaccine mandates and what we anticipate to come. So the hope today is we're going to answer some questions that we've been fielding from you all. This is 15, 20 minutes tops. We're going to keep it short and sweet, give you all the information that we can, keep it super impactful, and then send you back on your Wednesday. I'm sure we'll field some more questions and we'll bake them into our next session in 2 weeks. And sort of that's the cadence that we'll be on. So thanks for spending the time. This will be recorded. We'll send you the recording session. So if you need to jump away for any reason, we'll make sure you have it. But if you don't know who's our host today, or co-host, I should say, is our Chief Compliance Officer, Donna Thiel. Donna has just been just ears to the ground in terms of what's going on with these mandates, both from a health system perspective all the way up to the federal perspective. And so we got a couple of questions teed up for her today to keep this really impactful and give you all the information y'all need. So question one, Donna, what is going on with guidance that has been released? What is out there? What do we know today? Potentially, what are we still waiting on as well?
Great place to start. So good morning, everybody. Thanks for joining us again. Happy to be chatting with all of you. So as many of you probably already know, right, the two sets of guidance that we have received so far are for federal employees and federal contractors. Both of those sets of guidance came from the Safer Federal Workforce Task Force, or the task force as we'll call it for today. That task force was put together in January of 2021 by an executive order from President Biden. And so they were tasked with putting together the first set of guidance for both federal contractors and subcontractors, as well as the federal employees. And what we've seen from the guidance so far, I think, is that there will absolutely be exceptions for health reasons or religious reasons. Oh my goodness. And then there's a ramp up period, if you will. There's an effective date. But what's been interesting, and I was just looking at my notes here so I make sure I don't misspeak, but explicitly for the federal employees, the effective date isn't until November 22nd. So in our minds, I think we would say, oh gosh, we still have another month before we really have to be worrying about that requirement. But in reality, the expectation is that all federal employees will actually be fully vaccinated by 11/22. So what they're saying is that if you were receiving the Pfizer vaccine, for example, you actually had to have had your first dose by 2 days ago. And if you received Moderna, you actually should have had your first dose by the 11th of October. So I think we need to be thinking about the expectation when the guidance starts to come out for the rest of us, that what we think may be a runway or an opportunity for an effective date might not be exactly what we think it is. And we should really be prepared for that. So we know we have those two sets of guidance. What we are continuing to wait for, which is most important probably to the folks that are joining us today, is the information for our healthcare providers. So we're still waiting from CMS for that guidance, as well as the guidance from OSHA related to all employers of over 100 employees. So we keep hearing, right, it's coming any day, it's coming in mid-October. Hopefully that's the case, so that on our November 3rd briefing, we'll be able to talk about that. But I do think that people can leverage the information that we're seeing in the guidance that's already come forward and using that as a guide for what the expectations will be. It's interesting in the federal employee guidance, it really refers each of those agencies back to their own council. It talks about being somewhat of a collaborative process with the employees who are or are not getting vaccines, to work with them, to encourage them. There talks about, it speaks to kind of a period of education when someone comes forward and says, I'm not going to get vaccinated. So it's not meant to be instantly punitive, but, let's do some education. Let's try to help them potentially change their mind. Then let's have a period of, almost a suspension where we're going to wait and see what they're going to do, and then working with HR and legal counsel. So it feels a little bit more collaborative than what I expected. It does clearly have an expectation, though, that you're either vaccinated or you're not, and if you're not, you can't work. But it did feel like they were trying to communicate a desire for collaboration, and I think that is a good message for all of us, right? As we continue to try to work with our own employees and educating and trying to understand the why people have made the decisions that they've made regarding vaccinations.
Absolutely. As we back away from federal, let's then go to state, and then we'll end with health system and some examples that are happening out in the world today. As we, just covered the guidance that we have and what we're waiting on from the federal level, what's been happening at some of the state levels? What are some of the mandates that have gone into effect for certain states? What's the effect that that's had so far? Sort of what are we seeing on a state by state level as well?
Yeah, so New York certainly leads the charge, right, with mandating vaccinations. I'm just looking at my statistics. So about the end of September, they were talking or reporting that about 92% of all the employees at hospitals and nursing homes had been vaccinated so far. So they're continuing to mandate vaccinations. I think we've, on the opposite side of that, right, we've seen Texas come out and ban mandatory vaccinations. West Virginia, I think this week, it's still going through its legal process. It hasn't made it all the way through yet, but both another state that is trying to ban mandatory vaccinations. Certainly those state mandates cause consternation, concern by the healthcare providers who are about, and really any employer, right, who's looking at the federal mandate and trying to weigh where does that balance fit in? Am I following state law? Am I following federal law? I think we have seen consistently the states, a lot of legal actions coming from state actions where the mandates relative to mandatory vaccines have won out in the past. But we know the legal process, right, is it takes a long time, and it's very difficult for employers and health systems, I think, to weigh the balance between what should I do, what am I doing, what am I going to do tomorrow? And I think no matter what state you're in, you need to be following what's happening in your state and starting to put a plan together, working with council to figure out what's going to be the path that you're going to choose to take.
One thing that I would just love your insights on, because it's something that you and I have talked about quite a bit, has been almost a parallel work stream at the state level as it relates to licensure relaxation. We saw that interestingly come out of Nebraska. And I just love, it seems to be a parallel thread. And I'm curious to hear if you're hearing anything more along those lines, or maybe even just a quick 30-second descriptor of what that was and what happened in Nebraska. I think as we're talking and considering the audience today, we have so many folks in compliance and HR that are listening in, which absolutely we're talking vaccine mandates are top of mind for sure. But if there is such almost back to the beginning of COVID-19, when there was relaxations on state licensures from the medical boards, we may see that change or evolve and continue. And I think the example out of Nebraska is just a good data point. So I'd love to hear your thoughts on that.
Yeah, that's a really great point. And you're right. Back in the first quarter of last year, when everything started happening, almost every state had an executive order or a declaration of some sort that said we're going to extend licenses, or we're going to allow retired professionals to come back, or we're going to allow out-of-state telehealth, and all sorts of different declarations, emergency declarations in every state. And as a provider, right, it was really difficult to navigate that. We were very lucky at Provider Trust to have an amazing set of people who managed that for us and managed keeping track of all that and helping our clients with that. And you're right, just last week or the week before, I think it was just last week, Nebraska came out and once again really just cited the fact that we are fearful of losing staff. We already know we have a shortage of healthcare workers and qualified healthcare workers. And in order to continue to support our healthcare providers, we're going to continue to relax some of those licensure requirements. So they did in Nebraska, again, allow retired professionals to come on board. So we're seeing that. And I think, depending on what you read in any given day, you have one authority that says, oh gosh, we're able to get everyone vaccinated. We're not having a hard time. And then you look at another statistic that says, this year we lost 650,000 healthcare workers. So it's real. And I think the states are doing everything they can. I believe it was New Jersey, but I apologize. I'm not 100% sure, but states have offered the National Guard to come in and supplement in some of the health systems who are losing staff who are not vaccinated at this point in time. So the states are very aware and are absolutely trying to coordinate with the healthcare providers in understanding the vaccination rates, understanding the challenges they have. We have seen a number of health systems come out and talk about nurses that they're bringing in from the Philippines, for example, and in places where they may have done that for the last 5 years, but now really kind of elevating that need and acknowledging that we're going to be looking for healthcare workers outside of the United States because we just don't have the volume of staff that we need. So I think what we saw in Nebraska last week, I suspect we will continue to see in the coming weeks as these pieces of guidance come out, as mandatory vaccination takes place, not just at a health system level, but at a state or federal level. I think more and more states are going to have to pivot and think about how to support our healthcare organizations.
Absolutely. And so as we close out this just quick session today, we talked federal, we talked state, both licensure and in mandates. Kind of what's been the impact of peer health systems? If we peer around the country, what's been happening on the ground floor just in the last few weeks as health systems have started to put these in place? What has that meant for staffing? Who's doing this well? Kind of what's the quick summary of what you've been hearing and seeing from both our clients and from our partners in the market?
Right. I would say, honestly, what we're seeing and hearing is that the majority of staff are getting vaccinated. I think I wrote down some information. I read an article the other day. The president and CEO of Houston Methodist, Mark Boom, came out very strong, and they were the first health system in the United States to mandate vaccines. They did it back in April with a June implementation. And he just talked about his feeling that they are accountable for the safety and the well-being of the patients that they serve. And they had 0.06% of their staff that didn't get vaccinated, and all the rest of their staff did. And just really proud of, as he said, the men and women in his health organization that are caring and putting their patients first, and said openly his concern about the small percentage of staff that were going to a potentially a healthcare setting that didn't mandate vaccines. So I thought his position was one of really being a leader for his organization and feeling, taking a stand of what he thinks is important. I think most of what we're reading has been that the majority of staff have gotten vaccinated, but that's not to say that there aren't lawsuits and that there aren't groups of healthcare professionals who have stood strong and said, excuse me, we are not going to get vaccinated and we're going to fight for our rights not to get vaccinated. So it continues to be a very difficult subject for so many people. I think our health systems are seeing high vaccination rates, and I'm hopeful that that continues so that our health systems aren't continuing with the staff shortages. But we also know at the same time, many of our staff are burnt out, they're tired, they're exhausted because they're short-staffed just by nature, and we're just adding to that. But so far, I think the numbers are, I think, maybe proving out that more folks are getting vaccinated than what we originally expected to happen under these mandates.
Yeah, and the last thing I'll ask you today before we wrap for just this quick session is, some examples, and I know you have a good one with Signature, of how the internal communications and internal messaging and spreading information about the vaccine and making sure that employees have just accurate info from the health system that is getting delivered. And it's just it's been an interesting example you cited a few times. So I just what's the continued role for our friends on the phone to work with their internal comms departments?
Yeah, it's so important. And I think even in the guidance on the federal contractors, right, they had that kind of 5-day recommended education period. And I think I've said it, like I have said it many times, I think in different webinars and these sorts of coffee chats, but we have to understand why someone is making the choice that they're making, and just really truly helping to present factual information. We all have social media and just, we're inundated with information, and trying to really discern fact from fiction is really hard to do. And you mentioned Signature. They've done just a really purposeful, they've been very purposeful in their communication from their their chief medical officer and other healthcare staff within the organization, be it in Facebook. I mean, it's all different ways to get the information out. And I think it's just been very impactful, and it takes time and energy and resources to do it, but making sure that your staff have factual information, hopefully helps them feel comfortable in making the decisions for themselves and their families.
Absolutely. Friends, that wraps us for this quick session. It's intended to be 15 to 20 minutes tops, and just a quick brief into what we know, what we're hearing, what's going on in our corner of the universe. Our next quick brief, just like this, is on November 3rd, Wednesday, November 3rd. And hopefully by that time, we are anticipating getting a little bit more guidance at the federal level. I'm sure we'll also see some updates at the state level as well. And so I would just go ahead. We'll send you the link today if you want to preemptively go ahead and reserve your spot for that brief. But we'll be back in 2 weeks for another 20 minutes with some interpretation of what we continue to see. And hopefully by that point, we'll have a little bit more guidance from the federal level as well, as it's anticipated to hit mid-late October, and we are there. Friends, thank you for the time today. Donna, thank you as always. And with that, have a wonderful, wonderful Wednesday. We'll make sure you get the recording and a few follow-ups from us, a few pieces of content that we hope will be educational as you're going back and navigating all these things, as are we. So be on the lookout for that in your inbox. And as always, with any questions, we did get one or two. We will navigate them and circulate them internally. And if we can answer them, we for sure will reach out to you via email. Thanks so much for engaging. Have a wonderful rest of the Wednesday.
Thanks, everyone.